Yep,
The
I
three
found it.
dots? Yeah.
Got it. All right, so we are going to get started with our next phase of our tutoring session. And in doing so, this is going to cover the respiratory system from the physiological perspective. So what I'm going to do is hopefully go to share screen. And can you still see this, Cliff?
I still see it.
Okay, how do our body systems fit together?
I see it pretty good.
Okay, good, good, good. That's what you see though? Okay, great. So if we've not met before, my name is Professor Lisa Evers. My maiden name is Leshko, so I'm putting that in there now just because it's a pretty cool last name. And our purpose here tonight and for the next, tonight plus the next 7, Thursdays, Wednesday, Thursday for the next 4 weeks, we will be covering our different body systems from a physiologic perspective, but also with a focus on how nursing is impacted, how we apply some of our nursing skills. We start looking at the body systems a little differently, not just as the systems themselves, but we're also going to look at the purpose, some of the pathophysiology behind the systems, and also some of the nursing implications. And believe it or not, we're going to touch on a few common medications. We're not going to go into detail about the meds, but what I'm going to invite you to do at the end is to start creating some basic medication cards so that as you're entering into pharmacology, you'll have some flow and some understanding of the different types of classifications of meds as they fit into the body systems so that it becomes easier with each class that you're taking. So this is how we're going to approach things. We're going to build it one body system at a time. That's how we're going. Our body is set up that way. So in so doing, as I mentioned, we're going to look at what the purpose of the system is, how it normally works, along with a few common labs. This is not meant to be an all-inclusive, top to bottom, you will know everything about the system at the end. What it is designed to do is to pull out some of the pearls of wisdom and to put it in such a way that it sort of makes more sense to you, perhaps, not just memorizing a bunch of stuff, but to see how things start really fitting together. Most importantly, we're going to touch upon an important piece of the NCLEX process, which is how we get, we have to pass what's called the NCLEX at the end of our nursing experience before we can get our nursing license. And the way that those questions are formatted are based upon 4 client needs. And we'll look at that and we'll go over that again. I'm inviting you to get familiar with this today so that as you go along and you take each course and you take what's called a HESI at the end of each of our courses in nursing school, you'll have your scores broken down in these different areas. So it will give you an idea, a much more helpful idea as to where your strengths and weaknesses are. So if you've got a strength in an area, do you think you need to spend as much time on that? Or do you need to spend more time on your weaknesses? And if you stated weaknesses, you are correct. That's where you need to spend your time. So it's okay if we have some weaknesses as long as we identify them and we move through them and we learn from them. And as I mentioned, we're going to learn 3 common meds or the medication systems, and then some what's called HESI hints to review. And those are some pearls of wisdom that are found in our HESI NCLEX RN Red Book. It's a skinny, fairly skinny edition 5 that we're using right now. But whether you have it yet, or if you may not be into the term 3, I think you may get it. I'm not sure what happens in terms 1 or 2. You may not have it yet, but I want you to start getting familiar with some of the concepts, and this will be like a little introduction. Okay, so go ahead, let's get started. So the 4 client needs that we're going to focus on are safe and effective care environment. What does that mean? How do we, safety, safety, safety first. How do we keep our patients safe? We do so in a variety of different ways depending on the body system that's involved. Health promotion and maintenance. We want to keep our patients healthy. and we want to be able to teach them how to stay healthy. There's also going to be a psychosocial integrity piece of it. So obviously our bodies and our minds are integrated. So it's not just psych that is our psychological aspect, but the social aspect and how we keep all the body systems, the integration of those components is extremely important, because if one's out of whack, everything else gets out of whack. And then of course, physiologic integrity, and that's broken down into basic care and comfort, pharmacology and parenteral therapies, reduction of risks. That's sort of in the same category of safety, right? And then how does our body physiologically adapt? And so those are the ways I want you to start thinking about each of the body systems. It's not just memorizing. You take air in, it gets processed through the alveoli, and then we blow off CO2, or, that's not, I mean, it's part of it, obviously, but we also want to know, how does that impact our patient and how it impacts our nursing care? That's the details. So there are links for the NCLEX education websites, and I believe I have them at the end of the presentation, or you can also just, the test plan, there's links that we're sharing with students and stuff as well, because it is readily available and online for both RN and PNs. So I'm going to take a sip of water before we, and thank you for your patience. So we want to focus on our goals here, and then we're going to look at and we'll view things at the very end. All right, so this is how we're going to focus. Now, if I were to show you this slide and you're looking at, oh my goodness, what does all this mean? What often happens is when we look at a diagram like this, and it's basically showing how part of the angiotensin renin cycle and how it affects our blood pressure, okay? But a lot of times what happens is we just try to memorize it for the test. And it's like, oh my God, I just want to memorize it for the test and forget about it. Well, I invite you from this day forward to change that perspective and start really learning it so that you can understand how the body actually works together to maintain our blood pressure and how everything affects something else. So in this system, we have the liver, we have the kidneys, we have the lungs, we have the adrenal cortex. Where is the adrenal cortex located? Do you remember? It's on top of its friend, the kidney. Okay, and so all of these things are working together to help maintain our blood pressure. You wouldn't think that now, would you? You'd be like, yeah, no, there's just, this doesn't interconnect, but yes, it does. So everything is interconnected. And as soon as we learn that, we will learn that as we change one thing in the body, it will impact other things as well. So there's somewhat of a domino effect. So we breathe in and we breathe out. We breathe in and we breathe out. We're breathing in healthy oxygen and we're breathing out the carbon dioxide. So what we're going to do, and you'll see this slide pretty much in all of our 8 presentations that we'll do. Some of it applies more specifically, but I want you to just see this over and over, and we'll pick a piece of it as we go along. Our goal is to build upon and retain the information. It's not just, I don't want you just remembering it for a test. We need to start learning this, because 10, 20, 30 years from now, you still need to learn how the body, you still need to remember how it all works. So the role of the lungs in this whole renin-angiotensin system is that its role is to create or excrete some of the angiotensin converting enzyme. And we'll talk more about that as we go along, okay? So fabulous. And all of this being said has to do with how does it maintain the blood pressure. So if you can recall, family members or even yourself, you may be you may be taking a blood pressure medication called an ACE inhibitor, right? And I would imagine that many of you or friends or family may be on an ACE inhibitor. What that means is it's an angiotensin A, C converting E enzyme, ACE, ACE. ACE inhibitor. So it is going to prevent this enzyme it's going to stop the enzyme and prevent it from changing angiotensin 1 into angiotensin 2. Bottom line, if you're taking a blood pressure medicine, what do you think is the purpose of that medicine? Is it to raise your blood pressure or to lower it? You're right. You want to lower your blood pressure. So if you can recall that an ACE inhibitor lowers your blood pressure, you would know then that the angiotensin converting enzyme, the ACE itself, would raise or maintain your blood pressure. All right, so it's making those sorts of little connections that may help you remember this information as we move forward. I'm hoping, but there are no guarantees, but I'm hoping. So this is the angiotensin converting enzyme is found mainly in the epithelial cells. Okay, and we'll talk more about that. So I love this. You don't have to be great to start, but you do have to start to be great. And our goal here at Concord is we want you guys to have a really solid start. And we've identified over the course of many terms that our students have said, gee, I wish I would have had this, or I wish I would have had that earlier. And so some of the things that we identified were medical terminology, which we did in the first part of our session tonight, and then also some physiology review, and so that we can start pulling these pieces together. Okay, so let's get a little bit more into this. So this is going to just talk about some of the systems that we're going to be covering. And of course, first of all, we're going to cover the respiratory system, which is tonight. Next, we'll do cardiovascular, which is tomorrow. And I think you all have a handout. I think that Adon Davis provided that for you. The following Wednesday will be neuro. Then we'll do musculoskeletal. Endocrine system will follow. Then renal. So that's Wednesday that following week. Renal is that Thursday. And then finally will be, I think the week 9 is the GI tract, gastrointestinal, and then finally the immune system. Okay, so if you stick with us, you'll be able to go through these 8 systems, have a good review of some of the basic physiology, of course, and anatomy, and how it applies to nursing care, touch on some medications, and then some basic HESI hints as to how you can start remembering pearls of wisdom. So one of the things I'd love for you to remember is that our body's overall goal is to seek and maintain what's called homeostasis. And from medical terminology, whether you've covered it yet or not, homeo means sameness or similarity, and stasis means stoppage. So basically what our body does is once it gets to that same similar balance place, it wants to stop and be there, but it doesn't last very long there. And basically what happens is something will knock us out of whack again, and it's a constant up and down, ebb and flow, and it's never really stuck in the same place for very long. Basically, when things don't change, things are dead. So changing is good. And so the definition out of my old Mosby's book, Mosby's Dictionary, is that homeostasis is a relative constancy in the internal environment of the body, naturally maintained by adaptive responses that promote healthy survival. Notice it says naturally maintained. If we take good care of our body systems, our body can naturally maintain this adaptive process. Does that mean that they may not need medication periodically? Of course not. We may need meds periodically, but if we can change the problem that's out of balance in our body, we might be able to get rid of some of the medication that we may have been on previously. It's amazing. The body wants to seek homeostasis. It wants to stay healthy. So this is accomplished by all the systems working together in a healthy environment, allowing the ups and downs, the ebbs and flows, and then getting things back into balance again. So let's go ahead and start with the ABCs, which is where we always start in nursing. We want to begin with airway, breathing, circulation. That's where on NCLEX exams, we want to start there, okay? But tell me what you know about the respiratory system. Is it just the lungs? No, of course not. Where does all the magic happen? What are these grape-like kind of things and these red and blue issues here? They're called what? Alveoli, right? This is where the oxygen is exchanged with the gaseous, and the oxygen and the carbon dioxide are exchanged. And then in the red capillaries here, that's the arterial flow, and that's the oxygenated blood that's going back to the heart, so it can be pumped out through the body. And the other side is the venous part, where it's bringing the CO2 in. It's going to be exchanged then in the alveoli, and then you're going to get the oxygen. All right. So it's all just fascinating how it all works together. So what are the basic parts of it? What are we going to talk about? The purpose is gas exchange and perfusion. So in with the good, out with the bad. So you want to bring in the oxygen and exhale the CO2. We're also, a piece of it is perfusion, getting all of that to where it belongs, right? If there's a blockage in the respiratory system, can the oxygen get to where it needs to go? No, right? And so the perfusion would be impaired. So we have to recall that there's upper and lower respiratory tracts and the diaphragm. If there's an issue with our diaphragm, it cannot retract and stretch to make more room for the expansion of the lungs. So we'll talk about that. So from a physiologic perspective, we want to provide oxygen for metabolism in the tissues and remove the CO2. That's the basic thing that we want to do. If we can't do that, then the body starts doing what's called an anaerobic, without oxygen kind of metabolism, and that causes problems in the body. In addition, we need to expel the waste production of metabolism, which is that CO2. We've got to get rid of that. The functional units are known as the alveoli, which were those little grape-like structures within the lungs. That's where the gas exchange occurs. Some of the common labs we'll talk about, we're just going to barely touch upon arterial blood gases, ABGs, and in there is the pH, the CO2, and the bicarb, HCO3. We're also going to touch on O2 sats. And then finally, common pathophysiologies. We're going to look at some nursing implications to consider, and which is basically just dabbling, putting our toe into the concept of nursing diagnoses. All right, not a full night nursing diagnosis, but just maybe the first part, and then looking at some meds. So it's not just anatomy and physiology. We're taking it anatomy and physiology sort of 2.0 and giving you a nursing flavor to it. Okay. So you've seen the slide previously, and with our perspective here with the respiratory system, under number 2, health promotion and maintenance, one of our goals is to teach all adult measures to take to protect their respiratory system, including the avoidance of tobacco use. Now, in a regular anatomy and physiology class, you're not going to spend a whole lot of time talking about tobacco use. But from a nursing perspective, it's one of the key things that we need to do. We really need to encourage our patients to stop using tobacco and to support the adult who chooses to stop smoking. And by helping him or her decide if they need a drug therapy to do that, like the Nicoderm patches or whatever they're choosing to use, and finding them an appropriate smoking cessation program. So that is sort of how this is going to be applied. All right. So we want our patients to maintain their health and to promote health, which is basically telling people who are smoking that they or using tobacco in any form that it's harmful, and to not just tell them it's harmful, but find out, meet them where they are so that you can help them find a modality that supports them as they try to decide how they're going to stop smoking. So again, basic A&P. The upper respiratory tract, and we're going to have, there's a picture on the next slide, includes the nose, the sinuses, the pharynx, and the larynx. Which part of the upper respiratory tract is common in both the respiratory and the digestive function? Well, you probably know it's not the nose, it's not your sinuses, you're not taking food through there. Your larynx is your voice box, right? And so your pharynx is that part that is common to both the respiratory and digestive tracts. So with that, that helps you understand how people can easily aspirate, right? So if they're eating and there's an issue, like they're talking and eating and swallowing or laughing, you can see how that might get that food, instead of it going down the into the trachea, excuse me, not into the trachea, instead of you're eating and it's instead of it going into the esophagus, something happens and it gets into the trachea instead. So that would not be good. And that then gets into the lower respiratory tract, which is how folks get what's called aspiration pneumonia. So the lower respiratory tract includes the trachea, the bronchi, the bronchioles, which are the separations off of the major bronchi, the alveolar ducts, and then the alveoli themselves. From the lung perspective, do we have the same number of lobes on both the right and the left? No, we don't. The right has 3 lobes. And why do you think that is? What else is on the left side of the chest? What's on the left side of the thorax there? You're right, that's your heart. So the heart's taken up some of the space, so it only has room for 2 lobes. 2 lobes on the left, 3 lobes on the right. So if you look at how that's split up, you could look at the 3 lobes are about 60% of the respiratory function on the right, and then the 2 lobes on the left are about 40%. So each of the lobes is estimated to be about 20% of your respiratory function. So 20 times 5 is 100, right? You have 5 lobes, each 20%. There you go. And one of the accessory, what would you consider to be the accessory muscles of respiration? And that would be your diaphragm, which is underneath the lungs, and then your chest muscles themselves. Which direction does your diaphragm go when you inhale? The gut response that everybody typically says is it goes up, but that would be not correct. What happens when you're inhaling is that diaphragm pulls down, and it pulls down so that it makes more room for your lungs to expand. Just think about expanding a balloon. You need more space. So of course, if you pull down with the diaphragm, you're making more space for the lungs to expand. And so that's what the diaphragm that pulls down, and then that's an active kind of thing. You're taking a deep breath. The diaphragm's pulling down, and then as you exhale, the negative pressure, and you're just like, just up goes the diaphragm, and it helps to push out the air out of the lungs. Okay? All right. So here is a picture of the upper respiratory tract, and let's see if we can laser pointer. Ooh, good. All right. In here's the nasal cavity. Eustachian tubes, this is why, when you're having respiratory issues, sometimes you'll get ear infections because the entrance to the eustachian tube, which is part of your ear canals, that gets you some of those germs coming in your nose, can get in the eustachian tubes and cause infection. As the air's coming down, this is the nasopharyngeal, nose and pharynx, oropharynx, and then laryngopharynx, right? And so you can see here, this whole part here, the pharynx itself, this whole pharynx, regardless of the portion, is also considered to be part of the, when you're eating, you can see how the food would go into the oropharynx, and then hopefully it stays here going down into the esophagus, not into the larynx and the trachea. And what is the thing that helps protect it? Yep, the epiglottis. It'll help protect and keep the larynx and the trachea from getting food into it. That's how that typically works. Okay, so just recall that the pharynx is the part that is communicated with both the airway and the respiratory system and the GI tract. And that's why it is common that, not common, but possible for aspiration to occur when food or junk or chemicals or whatever gets into the lungs accidentally. All right. So here's the lower respiratory tract. Again, we talked about lobes, the number of lobes on the left and the right. The number of lobes on the left, boom, 1 and 2. And then the lobes on the right, you've got an upper, a middle, and a lower. each of which was about 20% of your oxygen or your respiratory function. So if you had lung cancer, my guess would be, if you don't really want lung cancer, but if you had to choose it, I guess you'd want to take one off of maybe the right side, take a little bit off of there. You have that extra lobe. You're still going to lose, if you lose one lobe of your lung, you're still going to lose about 20% of your ability, your oxygen, your respiratory ability. But you can still function okay with that 80%. That's okay. So look at how the right and the left primary bronchi differ also. This is sort of important as we're looking about if you have to intubate someone. So the ET tube, the endotracheal tube, will go down the trachea. So which of these looks like it's less angled? So if you go down here, the right mainstem bronchus, and then this one is sort of more angled, right? So what happens is it's easier to accidentally intubate the right mainstem bronchus. If you go down too far with the ET tube, it naturally will go the most direct route, and a lot of times you'll accidentally go down into the right mainstem bronchus. If you have the end of the tube here, I hope you can see it with the laser, then you're only going, will you be inflating the left lung? No, because the end of the tube goes into this section. And if you're only getting air, oxygen into the right side, what you'll hear is breath sounds on the right, but you won't hear breath sounds on the left. So the way that would be remedied is you would just untape the tube, and then whether the nurse, if they're more advanced practitioners or an ER nurse or critical care, would possibly pull back on the tube, get it back a little bit farther. And then if the end of the tube sits here, then you're getting oxygen into both of the bronchi, and as such, both lungs will expand. Okay, fabulous. So here is, as we're tracking all that down, you're looking at the left primary bronchus go in this direction, and then as we keep breaking down into the tiny, tiny airways, it eventually looks like this, and it breaks down, and then you've got all these teeny tiny alveoli within the alveolar sacs, and that's where the exchange of the gases actually occur. So how do we know that the body is exchanging the gases properly? The most effective way is to look at a blood gas, and that's known as an ABG, arterial blood gas. You can also do venous, but typically it's an arterial because you're looking at how oxygenated the blood is, and that's in the arterial system. So the normal blood pH is, as you will come to learn, 7.35 to 7.45. If you look on this slide, you will see that neutral is 7, and that anything bigger than 7 is considered alkaline. Anything less than 7 is considered acidic. For the purposes of our body's normal pH is 7.35 to 7.45. So as you look at that, would you say that our body is normally a little alkaline or normally a little acidic? You're right. It's normally slightly alkaline because our normal blood gas is above 7. So in the normal range for the human body to maximally function is between 7.35 and 7.45. If it is less than 7.35, it's considered acidosis. If it's more than 7.45, we're considered alkalosis. Brilliant, isn't it? All right, so a quickie review, mostly about the blood gases. If the pH is less than 7.35, the body is in a state of what? 7.35. If it's less than that, correct, it's considered acidosis. Do yourself a favor, and from this point forward, whenever you see the word acidosis, write it in red. It's less than 7.35, acidosis. That's the color things turn on a nitrazine stick. And so it becomes red or pink at the acid state, and then bluish or purple in the alkaline state. What's the normal range for the pH in the blood? If you said 7.35 to 7.45, you would be correct. My clicker may not be working. What's wrong with my clicker? Oops. It should have that. And then what is the normal range? If the blood gas is more than 7.45, what would you consider it? If it's more than okay. If it's more than that 7.45, what would it be considered? And if you said alkalosis, you would be correct. And again, do yourself a favor. Whenever you see alkalosis, be sure it's in blue. It will help you start separating those two terms, acidosis, less than 7.35, red, alkalosis, more than 7.45, blue. So acid-base balance, lungs on the top, whoop, kidneys on the bottom, both of which are extremely important for acid-base balance. They both work in unison to buffer the blood to keep it from getting too alkaline or too acidic. But what does the lungs deal with? And you know this because we already talked about it. It deals with carbon dioxide. It wants to go ahead and take that waste product that's produced from the metabolic activities in our body and exchange and blow off the CO2. You're going to excrete the CO2 as we exhale. It's an acidic substance and it's regulated by the lungs. The lungs are located in the respiratory system. So carbon dioxide, acidic, respiratory system, key pieces. What about our kidneys? They deal with the bicarb, HCO3. It's known as bicarbonate. What do you know is sodium bicarb? That is considered to be an antacid, right? Baking soda, sodium bicarbonate is the chemical makeup of baking soda. So it would be an alkaline substance and it's regulated by the kidneys. This is considered the metabolic side of the acid-base balance. We're not going to dig in too deeply beyond just those basic concepts and what the normal ranges and such are. So from the perspective of our respiratory system is responsible for the CO2 piece of a blood gas. It is considered an acidic substance and it's maintained and regulated by the respiratory system. Normal ranges of the ABGs. We've got our pH, which we were comfortable with already. We already talked about that. I'll take my laser pointer off. The normal pH is 7.35 to 7.45. This tells if our body's in a normal range. And we're looking at whether it's acidic, acidosis, or alkalosis. So if it's in the normal range, it's normal. 7.40 would be considered normal. It is neither acidotic or alkalotic. It's normal. If it is less than 7.35, then it would be acidic. More than 7.45, alkalotic. The next thing we look at in a blood gas is the CO2 level. The normal levels are 35 to 45 millimeters of mercury. This tells us if the respiratory system's functioning normally. So this is our focus in this particular system. If it is too low and is considered 30, we would be in a bad situation. And if it's too high, above 45, we're in an equally uncomfortable situation. Okay, so we're not going to get crazy about it right now, but we're just going to introduce these concepts. Bicarb normal values, 22 to 26. It tells us if the metabolic system's functioning properly, and we'll talk about that more with the renal system. Okay, I just want to introduce the concepts just a little bit. We're not going to interpret blood gases here. We're going to just save that for our fabulous faculty as we move forward with our classes. But just recall that the lungs are responsible for the respiratory piece of it. The respiratory system is dealing with the CO2 in the blood gas. Normal range is 35 to 45. which if you look at that, is the same as that 7.35 to 7.45, right? Just drop the 7, and then you've got that 35 to 45, okay? I'm so happy for that. So acid-base control and the mechanisms in the respiratory system, when the chemical buffers alone cannot prevent the blood pH changes, because that's what's happening even before it gets to the respiratory system. There's buffers within the blood itself. The respiratory system becomes the second line of defense, and it will either hyperventilate or hypoventilate. So you either breathe more to breathe off the CO2 or hypoventilate to retain the CO2. The lungs compensate for acid-base imbalances of a metabolic origin. So the most important thing here is if the lungs are broken and not functioning properly, then can the lungs fix the problem if they're having stress upon themselves? No. So then the metabolic system has to function and work in the kidneys to do the metabolic piece with the sodium with the bicarb. If the metabolic system is messed up, and the common thing to, I think, helps me always remember, is to think about diabetic ketoacidosis. Okay, in that disease, diabetic ketoacidosis, if you have any diabetic family members, you know that they're pretty sick if they get DKA, go into DKA. DKA, by definition, is acidosis, correct? All right. So one of the things, so with that, the blood gas is going to be lower than 7.35, okay? The normal thing that happens with that is the body, the metabolic system is messed up. The diabetic situation is out of control, and it's a metabolic issue that's the problem. So because it's a metabolic issue that's the problem, the acidosis, what happens is the body's like, oh man, I need to do something to try to help correct the acidosis. So as we talked about before, and I don't know if you remember it, but when we talked about CO2, that was considered somewhat of an acidic substance. So what the body wants to do is if it's trying to get rid of acidosis that's created from a diabetic issue, which is metabolic, your body is going to increase the respirations, because what it wants to do is breathe off, hyperventilate, and breathe off more CO2. And if it does that, that will help to correct somewhat the acidosis. So if you just put those things together and you recall that a diabetic ketoacidotic patient, DKA, acidosis, pH less than 7.35, common homeostatic balancing mechanism is to get what's called Kussmaul respirations, which are deeper and faster respirations. And the reason it's happening like that is to blow off the CO2, which is helping to get rid of some of the acidicness in the body. All right, it's a dabble. It's a little bit of a deep dabble, but I want you just to sort of start thinking about that particular combination of events. So, common problems. I told you we talk about common problems and some medication within the respiratory system. A common issue is a patient might present with shortness of breath. Well, they can be short of breath for lots of different reasons, right? They can have what is called impaired gas exchange, which is the first part of a nursing diagnosis. So impaired gas exchange, but we need to know why. Why do they have an impaired gas exchange, and how do we know? And that's the other parts of the nursing diagnosis. Not going to get into all those details in depth right now, but I want you to start planting those seeds of curiosity. They can have impaired gas exchange because maybe there's too much fluid in the system. If they have heart failure on that left side and the blood's backing up and the fluid's backing up into the lungs, that's too much fluid. Can the alveoli properly take care of the gas exchange if there's too much fluid and pressure there? No. So what happens is the patient is often given what's called a diuretic. Furosemide is a common one. It is a loop diuretic, and we'll talk a little bit more about that in the renal system, but it helps you to what's called diurese, get rid of some urine. And so if you have too much fluid in the system, a diuretic is going to decrease the amount of fluid in the system by making you urinate some more. You could also have impaired gas exchange because of bronchospasms, perhaps asthma. A common class of medication there is a bronchodilator, commonly aminophylline. If you can start thinking that there is a therapeutic range with aminophylline, and that's 10 to 20 micrograms per ml, that's a common medication that's given in addition to an albuterol inhaler. And then finally, you can be short of breath because you have an infection. And that's caused from germs or from possibly even aspiration, right? You can get aspiration pneumonia, or you can have a viral pneumonia, or the viral pneumonia typically does not get antibiotics, right? But an antibiotic might be used for a bacterial pneumonia, which is a common one, azithromycin. And the Z-Pak is being commonly used, of course, for COVID-19 in many cases as well. So what I'd like for you to do is to think about making a medication card, and I'll give you an example. And there's these are on the Teams sheet as well, with a medication sheet that starts looking at diuretics as a class, the aminophylline as a bronchodilator, and then antibiotics. And I'll give you an example of what that would look like. So what you can do is you can print these, and if you want to use this format, fabulous. If you have another format you would like to use, equally as fabulous, but I wanted you to have something that you could start using. And I want you to start building your arsenal of med cards or med sheets, however you'd like to do it. But you can basically start thinking in drug classes. So diuretics would be the category or class. The medication would be furosemide. So you want to start thinking. You don't have to drill down too much with this, but start thinking about why you would be taking it. What is the purpose? What is the expected action? And even if you just want to write, pee more, get rid of fluids, do the purpose of the medication in terminology that you understand that makes it easy for you to remember. Why would you use it? You would use it if in left-sided heart failure to diurese the patient. What could happen for complications? This is not a potassium-sparing diuretic, so you might get low potassium, which would be a bad thing. One which you might not give it. So just start filling out just some basic things. You all have a nursing drug book, and you also have access to nursing drug books online. So just do a very simple, even if it's just one sentence in each area, just to get you started. I don't want you to try to learn everything now, but I'd like for you to, at the end of each of our sessions, to have 3 drug classes that you would at least have some bit of familiarity with. Pick one important topic in each section, and then you've at least started your process for learning all of the intricate things that you're going to need to learn, and nursing interventions and contraindications, and also client teaching, huge pieces. Okay, so know why you give it and why you would not give it. I did post them, like I said, under class materials, under Teams. And like I said, if you have a different version that you'd like, fabulous. But I would suggest that you pick one. And even if you change, like when you get to pharmacology, that's great, but you still have the information here. So just get started, and it gets easier as we go along. And so this is the final piece, the HESI hints that I wanted to review with you in each of our sessions. So from the respiratory perspective, the HESI hints that are important to remember are that ammonia affects people of all ages, especially those 65 or older, or infants under age 2. And if they're younger than 2, their immune systems are still developing. And after age 65, our immune systems are somewhat diminished. And I've given you reference numbers of pages once you get your red NCLEX, the red HESI book, which is the thinner one. And the one I'm talking about is edition 5, which was in 2017. A second HESI hint: increased temperature increases metabolism and demand for oxygen. So fever can be an issue. It can also cause dehydration because you lose excessive fluid due to sweating, diaphoresis. The third point is irritability and restlessness are early signs of cerebral hypoxia. What does that mean? Basically means the brain's not getting enough oxygen. And so the common signs, if you start noticing that your patient who was otherwise doing well starts becoming irritable and restless, they're not just being cranky. Well, they may be being cranky, but a more severe thing that might be causing the problem, if they're not actively being mean and cranky, if they're just irritable and they can't, like, they're fidgeting and they can't get comfortable and they're just like something's up and it's a change from their baseline, check their O2 sat. And I think we talked about it, but O2 sat should be like 95 to 100%. So that is a good goal. Even asthmatics can usually keep a 95%. If it starts getting lower than that, you know they're starting to get into trouble. And you'll learn more about all of these things as you dig deeper into your classes. I don't want you to like try to memorize too much, but I want you to get started with the thought process and starting to learn labs. And that's why I spent more time on ABGs than O2 sats, because I think everyone puts an O2 sat on a finger and they look at that and you're more familiar with that. And then also the final thing is eating consumes energy, which is often needed for breathing. So if you've got a patient who is cachetic, meaning they've lost a lot of body weight and they're lean and tiny and they're not eating a lot, but they also have respiratory issues, then you're like, oh my gosh, they need to eat, but when they're eating, they're burning calories and they're not able to breathe properly. So the best thing that we can do as nurses, and from the medical perspective, is to offer them mechanically soft diets so that they don't have to work so much at chewing and digesting. And even a pureed diet, so they're still getting the nutrients. Their body doesn't have to work so hard, and that energy can be used more for breathing, and then also to assist them with feeding if necessary. So I really hope that you've enjoyed this presentation this evening. I look forward to seeing you hopefully the next session, which will be the cardiovascular system. And if you have questions, please, you can either post them on the Teams station or the channel there, or you can email me at levers@concord.edu. And I look forward to seeing you and hearing your feedback and moving forward and improving our familiarity and our success as we proceed together in our nursing studies. Thanks again. Okay, so that finished, and I will stop recording now and move on.